As we commemorate the World TB Day, also raising awareness about the health, social and economic consequences of TB, as well as stepping up efforts to end TB. The theme for this year's celebration is Invest to End TB and Save Lives. Our guests in studio this morning, Lillian Mutua, Head of Health Promotions at the Nairobi Metropolitan Services, accompanied by Nelly Motanya, who is the TB Coordinator, Ruaraka Sub County.
We encourage people, because TB is when you're in an enclosed place, you are more infectious in an enclosed place. So we encourage people to open windows. You dilute the bacilli by opening windows and then staying outside in the sunlight. TB bacilli pendant in the sunlight, so they stay outside so that it's able to kill the bacilli. So I think the community and the public is aware about the symptoms of TB.
It makes me happy that once we say there's this health day coming, the younger generation will quickly Google and see what it's all about. So the awareness is raised. And particularly in Nairobi, we've done a lot of awareness all the way from the primary schools, the high schools and the colleges. We are also entering into the space of the workplaces, like the industry, the Jua Kali. We've also had testing a month ago among the border riders. Previously, we had also done one among the Matatu crew, just to see what their prevalence is. We are also doing
What did you find? What are the findings?
They were not very bad, but for any person that tested positive, we were able to link them to a facility for care and treatment, and also do more testing for the people who are around them, their family or their significant others. And we also encourage those who have TB, once we have gotten their history, their lifestyle, we also request them even to do other tests like HIV. Because you could be having TB, because your immune system is low, because you have HIV. So there's also a lot of conversation that goes on with the clinician. We've also, as health promotion officers, entered into the correctional services, that is at the prisons, just to continuously educate them. We find that they are those who are already exposed, they have the TB, and in such institutions, then you find that they also, now there they can have the isolation, where they are given some quarters to live in for those who are positive with TB, so that, because the prisons are congested, so that they don't also infect the others, and they supervise to see them take their treatment. So even in the industries and companies, we've educated the supervisors and the managers that no cough should be unattended. If they have someone who is coughing for 2 or more days, that person should be encouraged to go to a good health facility, diagnosis made, treatment given, and if it is TB, they should support this person at least by giving them some time off for the first maybe 2 weeks, just to be away to take their treatment, and then they can come back, and they should not lay them off work.
Right.
They should support them.
So one of the speakers on the Voices we had talked about active and inactive TB. And I'm curious, is that also what's known as tuberculosis infection and tuberculosis disease, Nelly? Or are those different things?
Yes, we have tuberculosis infection, the one that I spoke about, that you can have. We are all exposed, especially in Nairobi. We are a high burden TB county because of overcrowding. So once we are all exposed to TB bacilli, we have the infection. Not all of us get the infection, but at least 90% of us get the TB infection. So the TB infection is contained in our lungs, but it is not active. We call it TB that is sleeping, it is dormant. So we are all having the TB infection. But because our immune system is trying to contain it, once the immune system goes down, then it is activated to active TB disease. This is now when you have the disease, you have the signs and symptoms, you start coughing, and you have unintentional loss of weight, you have fever, and you have all the cardinal signs of TB that will force you now to go to seek medical care in the hospital. Yes.
Lillian, we talked about how in 2020, for the first time in over a decade, the cases of TB went up. I found this interesting because with COVID-19, we started wearing our masks, there was social distancing. So how is it that the numbers of TB went up?
We know, just like any other scenario in health, this came with the scare of COVID-19.
Yes.
And people were seeing the way those who were having COVID-19 were being picked by the ambulances, the security, and being taken to health institutions. And this just brought in some social and psychological scare. And because of that, and COVID was a new disease, it also came with cough, it came with breathlessness. So anybody who got a cough did not want to be tested for COVID, to be known that they had COVID, because there was a lot of stigma around COVID. And we lost also some patients who were on treatment and care. They were not accessing their medication because they were scared of going to any health facility. Also, for the newly infected persons, we were not getting them because people were buying themselves drugs over the counter and not doing very well. And as much as we will say that there was the caveat of people washing their hands and putting on masks and keeping social distance, there was also the stay at home. You remember, for a long period, people were told to stay at home.
Yes.
People lost jobs. People just wanted to be indoors, which means if one person had TB, being closely knit within households, you could easily spread. And because of the scare of going to the health facilities, then many people are misdiagnosed by diagnosing themselves and getting them treatment, and also not going for proper diagnosis. This did not only affect the TB program. Even the ladies who are pregnant were not going to the clinics. The babies were not being taken for their routine clinic checks. So everybody kept away from health facilities. So with that happening, then there was rampant infections within communities. You can imagine in places like in the informal, people were not going to work, people were at home. So people were just crowding together for safety purposes, with a lot of anxiety, with a lot of mental anguish. So you find that is how our trends went high.
One of the things that come up whenever we talk about TB, of course, and you mentioned this earlier, Lillian, is stigma. It often comes up when you talk about the challenges in the fight against TB. Nelly, tell us how, in specific ways, stigma challenges the fight against TB.
Right. So when we have stigma, because there are myths and misconceptions about
What are some of those, by the way,
Yes.
myths about TB?
So there are myths that if you have TB, you have HIV, which is not the case, because we have many cases of TB who are HIV negative. So that is one myth. And another myth is TB is hereditary. It is not hereditary. TB is a bacterial infection that is airborne. So anybody can get TB. And sometimes people think that TB is for maybe the low class or the low socioeconomic. But TB can affect any race, any person of any class, and any age group. And another myth is that if you have TB, then you do not have cure. People think that if you have TB, then you will not get any cure. But we are here to say that TB is curable. So long as you are diagnosed with TB, it is curable, and you make sure that you take your drugs and finish the drugs as you have been prescribed for. Because it is a 4 antibiotic dosage, so you need to really take the drugs with due diligence. And then another case is that they say, some believe that TB, once you get TB, then you do not get another case of TB. Of course, once you cure TB and you have not taken your drugs well, then you can be able to get another infection of TB. So those are some of the things that bring about stigma. And once our community have that stigma, that is why we are trying to create awareness. We have gone through community strategy to create awareness to the community, health education, and that is why we are even commemorating this World TB Day, creating awareness about TB, and making sure that people are aware that TB is a curable, it is airborne and infectious. It is none of the myths and misconceptions that people perceive.